Hello and namaste. Today, it is my pleasure to introduce to our Lokvani audience Dr. Shefali Aggarwal, who is a medical oncologist and Chief Medical and Development Officer of Epizyme. A doctor by training, she has had a diverse career spanning academic medicine, clinical, and research. She has successfully led critical cancer drugs to FDA approvals, including ovarian cancer and lymphoma. More recently, she has started a philanthropic effort by founding Cancer Shakthi Foundation. A leader in her field, she was the recipient of the top 100 healthcare leaders in United States. She is often one of the invited panelist speaker at many oncology events. Very recently, she put together a beauty pageant. She has been the organizer for the Mrs. Bharat beauty pageant in the New England area. She has done it 2 years in a row, and recently she held the event at Ambrosia in Boston area. So a woman of multi-talents, Shefali, welcome to Lokvani. Namaste.
Namaste. Thank you, Ranjani ji.
Wow. I'm just amazed at the breadth of your activities that you have. But I'm very curious, what motivated you to really embark upon a career in cancer medicine?
I think there's a lot of reasons for it, but the main reason is my parents both are doctors, and when I was young, my dad passed away because of cancer, and he was a very well-known eye surgeon in India, and his last wish was that I do things in cancer research and actually help patients. So my goal to embark on cancer research, mainly focusing on the research part, has been that. And every time I approve a drug or I lead a drug, I feel that I have fulfilled his wish and I'm closer to what he's asked me to do.
Oh my goodness, that's amazing that as a young woman, this event kind of shaped your career path and that you were able to accomplish it. It's not a trivial path to say, hey, I want to become a cancer surgeon, and here you are, doing that. So God bless you. I'm sure your father's blessing is with you, and that's why you are able to do it. Now, of course, started as a, doctor, but you really have put a lot of effort, not just in the clinical area, but also in the research. And I think it is your passion. Could you tell us a little bit about what motivated you to get into research and drug development?
Yeah, I think, as a physician, I wanted to go into clinical, but I feel that at that time that there was a lack of drug development. And although there are a lot of developments happening in cancer research, it's still behind. There's still a lot of unmet needs in cancer, especially solid tumors like ovarian, breast, especially triple negative breast cancer. So I felt like somebody has to go towards the research part where we could develop the right drugs for the right patients and provide it to them. And that's why I focused my career more in research.
Fantastic. And I know that you have, come up with a lot of different drugs. So could you outline the areas that you have worked in and what are you most proud of in your journey?
Yeah, sure. So after I got off my school, I went to school at Johns Hopkins. And then when I got off the school, I basically decided to go into my first company called Wyeth at the time that
Yeah.
was then bought later by Merck. And so I started my career, believe it or not, in heme malignancies, chronic myeloid leukemia. And so I developed a drug there called bosutinib for that, and then moved on to breast cancer. The drug's name was neratinib in the same company.
Mm-hmm.
And then in my way, I have worked in renal cell carcinoma with tivozanib that was developed by Aveo. And then followed by that, I led a big trial, multiple trials actually, for ovarian cancer at Tesaro. And the drug is called niraparib. That drug was a very important drug because it's specifically for a mutation called BRCA in women in ovaries. So that drug was eventually approved by the FDA, and FDA was really excited about the trial design that we led. and that has been a very successful drug. And then lastly, after that, I moved on to a company that I'm currently Chief Medical and Development Officer, where I got an approval for an EZH2 inhibitor, which is an epigenetic drug for lymphoma, follicular lymphoma, and epithelioid sarcoma.
Wow. What is a epigenetic drug? I don't know what that, how is it different from the other kinds of drugs that you have developed before?
Yeah, epigenetic drugs are basically regulators of epigenetics, and they work on the cell pathway to basically before the cell or cancer starts. They basically helps the every drug, every cell has a genetic pathway, so
Ah,
it's basically an epigenetic regulator. And what you do is you target that specific mutation. So, for example, the drug that we have, it targets EZH2 especially, and then also wild type as well. And then the second drug that we actually have is a SETD2 inhibitor, which is also an epigenetic target. It's a histone methyl transferase, which is an enzyme that's important for that pathway. And so, basically, working in heme malignancies there, this drug is very important because one of the things that's very important is that a lot of companies don't work in pediatric cancer.
hmm.
And this drug was first approved in a rare tumor called epithelioid sarcoma, which is basically for kids all the way till 18, starting from 6 months. And it's a very horrifying disease because patients get amputated, kids get amputated. So this drug showed benefit, and it was a wonderful experience to meet the parents and hug them because they had an option for the patients who actually die within a year, which is very aggressive.
Oh my goodness, my goodness. Such an amazing experience, I can imagine, to provide a solution to a desperate parent, and so it sounds like in cancer, that's what you do. You inhibit the mutations, and that's how you prevent the cancer from growing. Is that the in general, the idea of the drug? Is that how it, I know I'm oversimplifying it, but
There are different ways to target cancer. Initially, many years ago, we used to do chemotherapy, which is basically targeting all the cells of
ah,
the body, and that way you kill the mutated cells as well. Cancer is basically normal cells that get mutated because of many factors, whether
yeah.
it is we believe diet or radiation or even like smoking and things like that. So it may cause that mutation. So we initially in old days used to just target chemotherapy and say kill all the cells, right? The normal cells and the mutated cells. But then that caused a lot of side effects. Like patients started suffering a lot. When we get chemo, you lose hair and things like that. So we got smarter and we started saying, okay, why don't we get the right drug for the right patients? I mean, find the mutations that are specifically for that patient, and those are called targeted therapies. And then many different targets. I can tell you,
Yeah.
cancer pathway is so complicated, and there's so many different mutations and targets that it's nobody knows.
Yeah, and that's what makes it exciting, I think.
Yeah.
So, and again, listening to you, I mean, I saw that, your excitement was to hug the parents and, be kind to them. And I think I see the philanthropic side of you coming right there, your compassion and kindness, in addition to your scientific excellence. So I know that led you to start the Cancer Shakthi Foundation. So could you tell us about this organization and what it does and what its accomplishments have been?
Yeah, so Cancer Shakti Foundation is a recent foundation that I founded. It was mainly our goal is to be able to collect finances or do fundraising to help patients, especially in third world countries like India.
Mhm.
And our goal is to be able to provide assistance to patients who don't have money for cancer drugs, whether it's in the form of providing some assistance in cancer drugs or providing other things that the cancer patients need. My
Mm.
goal is to be able to, and we know in third world countries cancer drugs are very expensive, and we are fortunate that we live in America where the drugs are covered by insurance, but in other countries there's just no finances to just pay for it.
Yeah.
And unfortunately patients die because they can't afford. So my goal with this foundation is that we create awareness in US, and I know there are many organizations like that. I'm a very small role, but basically create that awareness, and with community leaders like yourself or others as well, that we join hands and we basically provide that opportunity for cancer patients who are suffering in India.
Right, that's amazing. You said there are many organizations, but it's like the ocean, right?
Yeah.
The challenges are large, and
Yeah.
every drop counts, every effort counts. And I think yes, we should come together, but every individual effort can make a huge difference, so I think that's fantastic. And really, one of the things I think we are blessed to be in New England, where so many people are doing so much in a variety of areas. And even in cancer, I know that there are many people doing things, and I think that just goes to show the kindness in this area of the community, and hopefully making a difference in India, or and other places as well. So that's really fantastic. Now I have a quick question for you. I know that you have been focusing a lot on women's cancers like ovarian and breast. I know it's very devastating when you get such a news that there is somebody who has a breast cancer or ovarian cancer. What suggestions or ideas do you have for people to make sure that hopefully they don't get it, or if they get it, they catch it early?
I think it's very important. The main thing is screening. I think it's very important for women of our age, or like people who actually go beyond 40, to make sure they do normal mammograms. There are tests called CA-125. You do proper screening, just like in men, you do prostate and PSA, and things like that. You actually do checkup. Same with female. I think one of the things that we don't pay attention a lot is that screening is the most important thing. If you screen properly and you are able to screen at a regular interval as described by a doctor, then you can catch the cancer at early stage. And that makes a big difference, because if you catch the cancer early stage, then you're able to treat it with the drugs that are there. You are actually able to do surgery and then remove the tumor if it is amenable for that, and then treat it. However, if you go later stage, basically cancer gets disseminated all around the body. And because of that, targeting that is harder, and it's really then becomes very deadly for people. So what I'll say is regular screening. Get your CA-125 checked at regular screen, because CA-125 is a marker for ovarian cancer. Make sure you do mammograms at regular basis. If you see any signals like irregular bleeding and things like that, it may not be nothing. Please don't think that I'm saying it's cancer, but
Yeah.
just make sure you're aware of your body, and there's anything changing, anything different, that you can let your doctor know.
That's beautiful. I think awareness of the body is a very important thing. I think whenever we go to our physical, I think your own ideas of where your body was and what it's looking now, to see any changes, I think that's an important thing. And I think what you're saying is do your physicals regularly as at the recommended time, and so that things are caught early. And I think, am I right in assuming if they're caught early, a lot of good news there, right?
Yes, I think it depending on the tumor type, just to
Yeah.
be sure. But in many of the tumors, if you're caught early, like stage 1 and 2, it's much easier to treat them. And survival, we call that in a medical term, is much longer, because we see in breast cancer. I'm so excited about the advancement that's happening in breast cancer, prostate, and other tumors as well, including lung cancer, where there are so many drugs available now. And some of the specific drugs for mutations like ALK mutation, and there's so many, it's just hard
Yeah.
to name them.
Yeah.
But the whole idea is you understand, and then if there is anything, I know it is very daunting for the family, for the patient itself, for the person, but I believe that if you have positive karma and positive feeling around, you can beat anything. And so you get early detected and you get treated, and then that's everything. And that dedication and basically that strength is important.
Definitely. This is where the doctor meets the Purohit, So,
Yes, exactly right.
very
Exactly.
important. So that's beautiful. Now, speaking of beautiful things, this weekend I was really, really impressed to see the beautiful beauty pageant that you put together, and all in support of this great cause. So, what motivated you to bring these two very interesting fields together to make?
Yeah. It's been actually by chance. I met a wonderful person, Rashmi Bedi, who led the My Dream TV USA, and basically I partnered with her about before COVID, 2019, and we were three of us, who led in New England at the time, Raj Gupta, Rashmi Bedi, and I, and we basically led and did the first pageant, which was very successful. And then COVID hit. We
And
wanted to
it's
do
called
more.
the Mrs. Bharat, Miss Bharat,
Miss
right?
Bharat. It's
Yeah,
called Miss Bharat New England 20 at that time 2019.
yeah.
And then COVID hit, and it's very hard in COVID to come out and do things like that. And what I thought was that pageants are a way of empowering people, whether it's women, whether it is men, whether it's any category. And what it makes you feel good about yourself. And I've seen that time and time again, that women, when these girls come out there and they get dressed and they feel good about themselves, it's just a great feeling. And so I decided that maybe I can put the two things together, right? Maybe best of both worlds. Maybe you can do the pageant along with a good cause, and that way you're making happy everyone. You're making those beautiful girls and men and the community happy, and they're also able to donate money through via Cancer Shakti Foundation or to societies like LLS and others. So that's why I decided to do this. And this one was very special because, you know, I had a wonderful team who helped me lead this effort. And this was basically by My Dream TV USA. It was Miss Bharat New England 2021. And oh my God, it was just an amazing effort. And people like you, such distinguished people in community, were judges, and including, you know, people like Shefali ji, Rohit, you know, Yogita, Dipali, and Nisha ji. So they were such wonderful people who were on the judging panel. And we had some great contestants who put so much effort in every round. You were part of it. That was just very exciting.
Yeah, no, I mean, I was amazed to see the effort that had gone into it, and everybody looked so beautiful. I mean, from the tiny tots to the grandma who showed up, that was just fantastic. I thought, that they were able to, and just, present themselves on stage. Not everybody gets a chance to do that all the time. And so to see that was, they were happy. There were smiles on their face. So it was a delightful experience. And I was honored to be part of a small part
No,
of
I think
the
we were humbled for you to be there. And I think the part that is important is that it takes guts to
team.
go on that stage. I mean, in front of people and walk. And although, you know, that you know, being in medical field, everybody like thinks, oh my God, beauty pageants. What do you mean by that? But actually, it's a lot. It's a lot of strength, determination, dedication. It takes a lot to be there. And what I loved, I want to say some things about the community. There were so many people who came and encouraged. So there's one thing about the pageants, but an audience who's encouraging, who's actually there to support you, and the excitement. I mean, we had a big group of people there, and who supported the cause, especially because they knew that, you know, we are also raising funds for our foundation. So really thankful to the great community we have in New England. So humble and so supportive. I really say that they were just amazing.
Oh, that's and it takes a lovely leader to put things together as well. I know that it's not easy. I know there is sweat and blood went into doing that. So congratulations, Shefali ji, really. And I
Thank you.
I agree. I mean, I think beauty pageant is not about just the looks.
No.
There is so much to it. And I think the biggest value I saw for the presenters were that they were able to come out and speak. That's not an opportunity that
Yeah,
everybody gets, especially the teens and the young ones. Oh my God, they were
it
so,
was
so
so cute.
adorable. Yeah, and I think it's a training that will work well for them as they grow up, and whatever you do, it is going to be really important for you. So I'm so, so glad to see that. So now, at this young age, you have accomplished so much. You have a wonderful family, you have a husband, 2 kids. So what does the future look like for Shefali Aggarwal?
I think the future is, and I don't know if I'm going. I want to lead a company. I want to be, CEO of a company where I can lead the company for drug development. And it's not because just the title. It's more about being able to guide the company to be able to execute on my vision of trying to get the drugs to the patients. My ultimate goal is to be able to get as many drugs I can in my lifetime to the patients, so that I can help those patients in different cancers. It's a very tough disease, and having gone through myself personally with my family growing up, it's really a daunting experience. And even though I'm at this stage, I've not forgotten that experience, and that helps me to be humble. I hope I can, whatever I achieve, I want to stay humble and be able to help all those patients.
That's fantastic. And I know that CEO is never just a title. It's more work, more work.
More work.
The buck stops with you. So it's a very, very difficult job. And, more power to you, more, just very impressed that you want to take that role. And God bless you. So how does this woman manage everything? I mean, she has 2 young kids. She's a doctor. She has, all of these things. How do you put it all together? What advice do you have for other young people who might aspire to become Shefali Aggarwal?
So let me answer the first question. Why I'm here is because of my wonderful husband. I think I am blessed in that setting that I have a husband who's very loving and very supportive, and he helps me. We both together partner with kids as well as home. And if he was not there, I would not be successful in US, because without that partnership, nothing works.
Sure.
I also want to tell you one of the reasons why I'm here is my mom. She is my role model. She's a OBGYN in India, and she lost her husband when she was very very young, and all she did was dedicated her life to her kids and her career, and took care of, did just kind of did a lot of volunteer work, and also deliveries and things like that. So and she never stopped. She never stopped, and she's still working. And every time I look at her, I say, okay, I want to be like her. Even if I get a small drop of what she is as a person, as a woman, as a wife, as a mother, I'm good. I'll reach somewhere. So I think she is the strength and the pillar. And my sister, we it was, being in India, we were three women in that world. And my sister has been her name is Sonali, has been my love of my life. I can tell you, we three are very connected to each other, and that keeps me moving along with my lovely family, my two kids, Sanaya and Sumaira.
Well, God bless you. You're very, very, I think, right in saying that a strong family enables empowerment of women, So
Yeah.
actually, sometimes I see, when they talk about empower of women, they will show Draupadi or Mahishasura
Yeah.
Mardini. No, no, no.
No.
It is people holding you, people
Yes.
supporting you. You need the pillars, and that's the empowerment. That's when a woman can break out and do, all that she is capable of. So I think you really brought that point out very well. So blessings to your family, blessings to
Thank
your
you.
mom. I mean, I think anytime I see very successful woman, there is a mom
Always.
somewhere, such a very, very motivating mom and a supportive spouse. I've heard that more times than I can tell you. So Shefali, really great wishes to enabling all success to you. Any message for our readers
Yeah.
as to how they can support in all your endeavors?
Yeah, I think first I didn't answer your previous question about what girls can do. I
Uh-huh.
think girls can do anything. I have two girls, and I believe that you can do anything as long as you have the motivation and dedication. And don't let anybody tell you cannot do it, because you can do it. And I'm telling you, you're not less than anybody, whether it's America, whether it's India. So I will give a message that please keep working hard, keep dedicated, and be honest to yourself and humble. Don't forget that humble nature, because if you don't, if you're not humble, then all that achievement doesn't matter. So I want to just say that please keep working. I have a team of almost 100 people in my company, and what I tell them is just be honest and keep working hard, and eventually you will succeed. And so that's the message I wanted to say. And I think in terms of, what was your second question? I'm sorry.
About supporting the initiatives for cancer and other things that you're doing, what would you encourage our community to do for you?
I think what I would love to do is, as I would hope to do more events in future, and mainly dedicated to cancer fundraising, and hopefully another pageant. And the whole goal is to be able to get those funds, or not only just the funds, but also that motivation for people to come together. I hope we can unite hands and not worry about one person. We have this group and we have this group. We're all together in this. And if we can partner together and be able to provide that support to people in India or even other countries, the third world countries, it'll be great. So what I would request is, please join hands. I would love to join hands, and let's do it together and beat cancer.
I love that. I love that. So what you're saying is you don't have to be a doctor. There's so
No.
many other ways that you can contribute, whether it's by building awareness, whether it is by organizing events for fundraising to support cancer patients. So I think each one of us can make a difference with our own talents, with
Yeah.
our own connections, and our own ideas to
Yeah,
make
and
a
it's not
difference.
even about money. If you just get together and brainstorm and just join hands, and sometimes the word of encouragement is good enough. If, like, when I met you, you were so encouraging. So if people like you and others who actually come and hold hands, our hands, our generation, then we can bring everything together, up, and then hold your hand. So I just want to join hands with everyone.
I love that. I love that. Let's all come together, as John Lennon would say.
Yeah.
So, absolutely. Let's do that. Let's come together. And I really look forward to that day when cancer is like a common cold and we don't have
Yeah.
to worry about it as much anymore. And there are solutions, and it's not the worst news that a family receives. More power to you, Shefali ji. More power to
Thank
you to
you.
discover new drugs, bring them to market, and most importantly, help people in the world.
Patience. Yeah,
Thank
I
you
think
so much, Shefali ji. We look forward to hearing from you again next year or something when you might have other drugs to talk about or anything else that you would like to talk about. Thank you so much.
thank you,
And
Ranjini ji. Thank you for the opportunity. Bye.
namaste.